V-stitches, a technique for repair of traumatic horizontal or oblique meniscus tear. The others have nothing to disclose. A 52-year-old patient presented with left knee pain for 1 week after a fall. The knee was found swollen 1+. Medial joint line was tender. Anterior allotment test was 2+. MRI showed tear of the anterior cruciate ligament and horizontal tear of the medial meniscus. This is the left knee. The anteromedial and mid-medial portals are guided by a needle, with the knee in extended and valgus position to direct the instruments to the working area. Pie crusting release of the MCL can be helpful. A horizontal cleavage tear is identified and rasped. Meniscus is stitches from the periphery to the center. We can break down these stitches into 3 steps: outer stitch, middle stitch, and inner stitch. Step 1. Outer stitch. A cannula is placed in the anteromedial portal for suture shuttling. The mid-medial portal is used for suturing. The stitch begins at the meniscal capsular junction, from superior to inferior, to shuttle the number 2O fiber wire in. Step 2. Middle stitch. The lasso is placed to a more central portion, to a distance less than the thickness of the meniscus at that point. A shorter than B. Use a suture retriever from the anteromedial portal to shuttle the loop of a fiber wire to the upper surface of the tear to prepare for step 3. Step 3. Inner stitch. The lasso is inserted through the fiber wire loop and then advanced centrally, again at a distance shorter than the thickness of the meniscus at that point. The suture lasso then passes inferior to shuttle the fiber wire through the loop of the fiber wire at the upper surface. The knot is tied. Tension is adjusted to make sure the tear is compressed properly and there is no deformation or strangulation of the meniscus. The cross-section of the loop from a V-shaped configuration as shown. Thank you.